Hello there, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about inferior vena cava. So, vena cava inferior, it's, I guess, it's the biggest vessel in your body. It's situated near the aorta descendens and it originated on the level of discus intervertebralis between the fourth and fifth lumbar vertebrae, from the union of common iliac veins, left and right. As you can see, vena cava inferior, it's laying next to aorta. It's actually situated to the right from aorta, to the right from the vertebral column. It go up, so it go through abdominal cavity, then it go through diaphragm. You remember, in centrum tendinum of diaphragm you have opening for vena cava inferior, foramen vena cava, and it enters thoracic cavity. It have no tributaries in thoracic cavity, it's just fall into the right atrium. It have tributaries only in abdominal cavity. It's similar to aorta and have parietal and visceral tributaries. So if you talk about parietal, they same as the parietal branches of abdominal aorta. So we have vena phrenica, inferior, left and right, inferior phrenic veins. It's, as you can see, it's laying on abdominal surface of diaphragm. It's drain blood from diaphragm and from the muscles of abdomen, and it can create some anastomosis, as you can see, with suprarenal veins, with esophageal veins, and musculophrenic veins near the intercostal spaces. And that's all about inferior phrenic veins. If you talk about lumbar veins, vena lumbalis, you have like 4 or 5 pairs of lumbar veins that originated between muscles of abdominal cavity, lateral mostly, drain blood from these muscles, transversus abdominis, obliquus internus, obliquus externus, quadratus lumborum, iliopsoas, and also even rectus abdominis. Also, these vena lumbalis, they are similar to vena intercostalis posteriores. They have also small tributary that fall to them. It's vena intervertebralis. Blood from the spine, from the muscles of your back, from the subcutaneous tissue, from the spinal cord and canals vertebralis, it also drain to the vena lumbalis. So vena cava inferior have few visceral tributaries that are from paired organs, and the main of them is vena renalis, dextra sinistra. As you can see, left and right kidney vein are fall into vena cava inferior. They are different because I already told you vena cava inferior situated to the right from the aorta, to the right from vertebral column. So the distance to left kidney and to right kidney are different. So as you can see here, the right vena renalis, it will be short, but the left one will be long because there is the long distance to left kidney. So, and it have few feature. As you can see, vena renalis sinistra, left one, it crosses aorta and it go in front of aorta, but one branch of aorta, it crosses vena renalis sinistra. It's arteria mesenterica superior, superior mesenteric artery. It crosses, it's like bend over vena renalis sinistra and go to your internal organs. Next, we have suprarenal gland, glandula suprarenalis, so we will have vena suprarenalis. But here will be feature. Only right one vein will fall into the vena cava inferior. Only vena suprarenalis dextra. Left one, as you can see, vena suprarenalis sinistra, it's fall in vena renalis sinistra, to the left kidney vein. And the last one, visceral tributary, it's vena ovarica or testicularis. In female and male it will be different. Vena ovarica or testicularis, it begins, if we talk about male, it will begin in scrotum from the plexus that calls plexus pampiniformis. Pampiniform plexus that will spread into the funiculus spermaticus to spermatic cord, and from spermatic cord it will go further, and from this plexus pampiniformis transforms into the vena testicularis, left and right. And if you talk about right one, here is right testicular vein, go up and fall into the vena cava inferior directly. But if you talk about left one, here is vena testicularis sinistra, it go up and fall also in vena renalis sinistra, not in cava inferior. If you talk about female, also on margo mesovaricus of ovarium, there are also beginning of plexus pampiniformis that will go up in ligamentum suspensorium ovarii, then transforms to vena ovarica, and left vena ovarica also fall into the left renal vein, and right vena ovarica fall into the vena cava inferior. And the one thing that will differ on branches of aorta and tributaries of vena cava inferior, it have few more tributary from the hepar. Here is vena hepatica. So here you have this vena hepatica. There can be 3 or 4 of them, it vary, but all blood from hepar, it's drained into the vena cava inferior. Vena cava inferior originate on the level of 4/5 lumbar vein from the unite of left and right common iliac vein, vena iliaca communis dextra and vena iliaca communis sinistra. It's short vessels, but also, as you can see, left one it's longer than right one, and both of them originated on the level of sacroiliac joint from the unite of internal and external iliac veins, vena iliaca interna and vena iliaca externa. So right one, as you can see, have no tributaries, only left one have this small tributary. It's, as you can see, short vein that accompany the same artery and have the same name. It's vena sacralis mediana that originated from sacral plexus, plexus sacralis. Right one have no tributaries, they join and transforms into the vena cava inferior. So I must to say, first of all tributaries of vena iliaca interna, it's accompany the same arteries, same branches of arteria iliaca interna, have the same name and the same regions of drain. So vena iliaca interna. It's situated again on the sides of your pelvis and have parietal and visceral tributaries. If you talk about parietal tributaries, there will be vena glutea superior, vena glutea inferior, vena obturatoria, vena sacralis lateralis, and vena iliolumbalis. To talk about visceral tributaries, you must know that all veins of the organs internal will create plexuses around these organs. So if you have vesica urinaria, there will be around it plexus vesicalis. If you have rectum, around it there is plexus rectalis. If you have prostata, there is plexus prostaticus around it. If you have uterus, there will be plexus uterinus, and vagina, plexus vaginalis. So visceral branches are from plexus vesicalis, you will have vena vesicalis, superioris and inferioris. Next, from plexus prostaticus, there is a vena prostatica. In female will be vena uterina, big, and vena vaginalis. Next, there is a big plexus rectalis and will be few veins. Inside rectum, between the layers of rectum, there will be a big plexus, plexus rectalis, that consists of like internal hemorrhoidal plexus and external hemorrhoidal plexus, and from all these plexuses blood drained by 5 veins. Superior rectal, it's tributary of mesenterica inferior vein, it's next topic. Vena rectalis media, that fall right straight into the vena iliaca interna, and rectalis inferior, vena rectalis inferior, that drained into the pudenda interna. So here we go to the last visceral tributary of vena iliaca interna, it's vena pudenda. interna. Vena pudenda interna, it's accompany the same artery, and as you can understand, it's originated in perineal region. And if we talk about male, it will consist from a vena dorsalis penis and vena profunda penis, then vena scrotalis posterioris add to it, fall into it, and vena perinealis fall into it, then vena rectalis inferior fall into it, and then its vein go through foramen ischiadicum minor, then go through foramen intrapiriformis and fall into the vena iliaca interna. If we talk about female, then the beginning of this vein will consist of unite of vena clitoridis, vena profunda clitoridis, and vena dorsalis clitoridis, and vena labialis posterioris. All the other will be the same. If we talk about vena iliaca externa, external iliac vein, it's originated from lacuna vasorum. It's straight continuation of vena femoralis, and it have only two tributaries. First one, it's vena circumflexa ilium profunda, deep circumflex iliac vein that make anastomosis with iliac branch of iliolumbalis vein and drain blood from iliac bone, iliac muscle, and muscles of your abdomen. And second, it's vena epigastrica inferior. Here, vena epigastrica inferior that originated from rectus sheath inside musculus rectus abdominis and make anastomosis with epigastrica superior, that is tributary of thoracica interna. And now we go to veins of lower limb. So all veins of lower limb you can divide on deep and superficial veins. And we begin with deep veins. And deep veins originated right on the tip of your toes from digital plantar veins. So we have vena digitalis plantaris that will unite and create vena intercapitularis between heads of metatarsal bones, then transforms into vena metatarsalis plantaris that all they unite and create plantar venous arc, arcus venosus plantaris, that transforms into the vena plantaris lateralis, and from the first toe will be vena plantaris medialis. They will unite and create two vena tibialis posterior, two posterior tibial veins that go up, have few tributaries. Main of it's vena fibularis, and will in popliteal fossa will join with anterior tibial veins. Anterior tibial veins, as you can understand, it originated from dorsalis pedis vein that created by arcuate veins. Here is vena tibialis anterior, go through opening in membrana interossea cruris and join with vena tibialis posterior, and there is beginning of vena poplita. So here is big vena poplita, poplital vein that go up, accompany same artery and enters canalis adductorius, you remember, so through hiatus adductorius. So vena poplita actually drain blood from your knee joint and the muscles of your leg. It's musculus cruropoplitus and soleus. So when vena poplita enters hiatus adductorius, it transforms into the vena femoralis. So femoral vein go through canalis adductorius, go up, and then vena femoralis go through lacuna vasorum in the middle position from arteria femoralis and transforms into the vena iliaca externa. So vena femoralis have few tributaries that the same, that is branches of femoral artery. We have the biggest one, it's deep femoral vein, vena femoralis profunda, that have this tributary vena perforantes, medial circumflex and lateral circumflex femoris veins that drain blood from your hip joint and the muscles of your hip, quadriceps femoris and sartorius. And a few superficial branches that are, as you can see here, it's vena circumflexa ilium superficialis here, that make anastomosis with deep circumflex ilium vein. Then it's vena pudenda externa Here is external pudendal veins that drain blood from external genitalia. The main one, it's scrotalis anterioris or labialis anteriors in female and male, and epigastrica superficialis vein. Vena epigastrica superficialis that make anastomose with thoracepigastric vein. I told you on previous topic it's tributary of axillary vein. And we have on lower limb we have only two superficial veins, big and small, or great and less. So everything begins on your foot, on the dorsal side of your foot. As you can see from your vena metatarsalis dorsalis, they all fuse and create your dorsal venosus arc, arcus venosus dorsalis pedis. And from this arc, from its lateral and medial margin, there is beginning of lateral and medial marginal veins, vena marginalis medialis and vena marginalis lateralis. This medial marginal vein, it's go up in front of your malleolus medialis and then transforms into the vena saphenum magna, to the great subcutaneous vein. Vena marginalis lateralis, it go behind malleolus lateralis, and then it transforms into the vena saphena parva, to the lesser subcutaneous vein. If we talk about vena saphena magna, it go up on the leg. It's drain blood from anterior and medial surface of your leg, then it go around your knee joint, get this tributary vena vena infrapatellaris, then go up on the hip, and in the place where is hiatus saphenus, as you can see, it bend over cornu inferior of margo falciformis and fall into vena femoralis. Vena saphena magna have a lot of tributaries. It's drain blood from all your hip region and leg region, and also there can be accessory grade subcutaneous vein, vena saphena magna accessoria. If you talk about vena saphena parva, as I already told, it originated from vena marginalis lateralis and go up behind malleolus lateralis on posterior surface of your leg, go up, it drain blood from your posterior surface of leg and enters fossa popltea, penetrate popliteal fossa and fall into the vena popltea. As you can see, there is a lot of anastomosis between vena saphena magna and vena saphena parva, but vena saphena parva it's actually short. So I guess that's all about system of vena cava inferior. Thank you for your attention. Subscribe to my channel, ask me some questions, and see you later. Peace.